Hi, this is Dr. Alex Shvartsman. Today we're going to talk about how I came to be a dentist and why I started a holistic dental practice from scratch. I'm a natural born artist and I love science. So when I was growing up, I realized that I'm going to spend most of my life at work. So I decided to, if I'm going to do something for work, I'm going to do something that I love to do. And so dentistry became a natural decision for me. When I went to dental school, I found out that dentistry came very easily to me. And I loved it. It was like arts and crafts. It was doing what I've always loved to do, sculpting and drawing. To me, dentistry is a marriage between art and science. And I love both, and I'm good at both, and so dentistry is something that I do for fun. I get to help people, and that feels great. It's a good feeling, and it's great, it's very fulfilling, it's very rewarding. I would definitely do dentistry for free if I could. In the 90s, cosmetic dentistry was all the rage. So it was perfect for me. I get to be a cosmetic dentist, and what I was taught by all the cosmetic dental gurus is that I'm gonna change people's lives by changing their smile, and that sounded great to me. I spent the first decade of my career flying around the country, learning from the best of the best in cosmetic dentistry. It all really began in 2001 when I decided that it was time to get healthy. I ate a lot of healthy whole grains, a lot of beans, and a lot of non-processed food. And what happened to me is I got very, very sick. And for 3 months, I had chronic diarrhea, and I was getting worse and worse. But I was convinced that I was doing the right thing. So what I did was, I kept doing it. I just figured my body was getting used to it. And then I was driving home one day from work and I heard an interview about the ancestral diet, the diet that our body biologically is designed to eat. And I learned about the ancestral diet and ancestral health. And I pursued that, and all of a sudden, I leaned out, I became healthier, my blood work became normal, and it was great. I was already eating a natural diet, a natural human diet. And now I was introduced to a natural way to rebuild teeth. The problem with dentistry is this: it's based on 1800s woodworking principles, and it's based on 1800s dentistry. And the sad truth is that most, if not all, dental schools in the United States teach this 1800 antiquated approach. They had very few things to work with. They had metal and they had metal. And that's all they had. It was either gold or a new cheap material, which is a mixture of mercury and silver ground together in a mortar and pestle and stuck into teeth. My approach to dentistry is fusing the modern approach to dental care with a more natural tooth conserving approach. And the way I got to that is it all began with biomimetics. So biomimetic dentistry is the concept of rebuilding teeth to mimic how nature built teeth. We, biomimetic dentists, use materials that match the physics of the tooth in every different layer. For the first time in my life, I began rebuilding teeth to emulate how nature made them. And that makes for much better, longer lasting restorations of teeth. I was already eating according to nature, and I was rebuilding teeth according to nature. And then I got sick. I was suffering from acute and very serious mercury toxicity. You see, as a cosmetic dentist, I took a lot of fillings out, a lot of metal, mercury, black fillings, ugly fillings. I never really placed mercury fillings in my private career because I was a cosmetic dentist and I was pulling them out. But I was doing it not safe because I was told by my profession that there's nothing wrong with it. It's completely safe to inhale clouds and clouds of mercury vapor. I was slowly poisoning myself. And the sad thing is, so are a lot of other dentists. They just don't know about it. And they're experiencing a lot of health problems, a lot of neurological problems because of it, but they do not believe it's coming from their career. So what I signed up for was a toxic career. When I started writing articles on biomimetic dentistry, my profession was not interested. I went online, I spoke to a lot of dentists, I told them, there's a better way to do dentistry. Let's mimic nature. We have a blueprint. Let's have materials that actually match the physics of the tooth. If my colleagues are not interested, I'm going to go to the people. I'm going to go to the public, and I began writing articles. And I began writing articles about Modern Dentistry, and something interesting happened. All of a sudden, this group of people started coming to my practice who would call themselves holistic. And whereas before, I thought of them as nuts, now I welcome them. Today, I don't treat people as a naturopath. I treat people as a dentist, using naturopathic principles and pulling from other areas of natural medicine to help to improve or augment or make better the dental care we provide. In medicine today, the sweet spot lies in integrating the best of modern technology, modern medical or dental technology, with minimally invasive techniques and natural medicine. The less drugs and synthetic materials we use in people's bodies, the better. Because the truth is, our bodies work better with nature. All these new synthetic molecules that we're making up and putting into our bodies is very confused. Our body has no idea what these molecules are. Nature has never seen them. And so nature gets confused and nature breaks down. We're confusing our bodies, and our bodies are becoming inflamed, they're burning up from the inside, and we're getting sick. I think most of the conventional medicine, conventional dentistry, is too focused on symptom treatment. And that's the culture we live in. Look at dentistry. You come in with a cavity in your tooth or gum disease in your mouth, and what do? We treat the sequelae, or we treat the end result of these diseases. We don't treat the cause, or very little is, we think about the cause, but we don't really do much about it. We're just focused on treating the symptoms. Dig out the decay, fill it in with whatever, scrape the gums and hope for the best. And what happens is we are basically tooth mechanics or tooth carpenters. We just fix the problem of the end stage of the disease. We spend as much time on helping our patients cure themselves of these diseases by following our protocols and utilizing a lot of natural medicine in the process, as well as fixing the teeth, fixing the mouth back to health in a more natural, more conservative way. We found almost like a unique way of helping our patients. We're every month, every year, we're adding new products, new techniques, and new knowledge to our repertoire. And it makes me feel great. It makes me feel proud of what we're doing here. So I welcome you to look at our website, check out the pages, check out the articles. A lot of work and effort is put into that, all for your education. So I look forward to meeting you. Please give me feedback on my website. There's an Ask Dr. Shvartsman tab. Let me know how you feel. Visit our YouTube channel at healthierdentistry.com. Check us out. Let me know how you feel. I'd love to see your comments and your feedback. And I love to talk to people, and I'm always open to questions and comments. Take care.